My name is Jara Fortaleza and I'll be your student nurse today. And I will be assessing my patient's head and neck. That way, if I see any abnormalities, I could report it to the doctor and see if there's anything that there's any presenting symptoms or any history of any diseases that I could relate to my findings today. So first, I would like to identify the patient's information and verifying it with them. Hi ma'am, my name is Jara and I'll be your student nurse today. I would just like to verify some information with you. What is your full name, please?
Jazz Borzon,
And your age?
39,
And what is your date of birth?
February 3, 1982.
Thank you so much for giving that information. So, first I would like to explain to you what we're doing for you today. I would be assessing your head and your neck. I will be touching your head and see if there's any abnormalities present, if that's okay with you.
Okay.
All right, so I would be giving the patient some privacy before I start this procedure by closing the windows and the doors. And I would do my hand hygiene technique. I would get a pair of gloves for me to wear. And I would get my pen light ready if there's any abnormalities that I could find as well. So first I would like to see if my patient's head is symmetrical. All right, looks like it's even and it's round, and it doesn't seem that there's any abnormalities present. Do you feel any tenderness?
No.
All right, looks good. Everything's feeling okay. And her head seems round and it looks intact. And let me just see. Can you please move your head right and left? All right, thank you. Any tenderness on those muscles there?
No.
All right, can you put your head in? And I would just like to assess your muscle here. Any tenderness?
No.
All right, the other side, please. Okay, any tenderness?
No.
Very good. All right, you can face me. And I would just like to check on your lymph nodes to see if there's any swelling or inflammation of the lymph nodes. So you want to check all the lymph nodes under the submandibular lymph nodes, submental lymph node, preauricular lymph nodes, postauricular, occipital lymph nodes, clavicular area to see if there's any lumps, bumps. All right. Is there any tenderness when I'm palpating on these areas here?
No.
I could see that her lymph nodes are mobile. They're not big. I could feel that the size is just normal. There's no swelling or inflammation. The patient doesn't seem to have any tenderness when I'm palpating. I would like to check on your throat. You can tilt your head a little bit back, not too much. All right, thank you. And I would see if the throat is deviated. Doesn't look like it is. It's symmetrical. It's in the midline. Any tenderness when I'm palpating in this area?
No.
Very good. All right. You would like to check also the tonsils of the patient. Please swallow for me. Okay. Any pain when
No.
swallowing? Very good. You would like to check if there's any enlargement on the thyroid. You would like to palpate that area. It feels like there's like a butterfly lobes here. If there's any enlargement, maybe it could present hyperthyroidism or any thyroid problem. All right, looks good. Okay. Do you feel any tenderness or any discomfort when I'm doing that procedure for you?
No.
All right, very good. So let me also check her sinus. There's some maxillary sinus right here. Any tenderness or discomfort when I'm doing this?
No.
Okay. And her frontal sinus. Any discomfort?
No.
Here as well?
No.
Everything's okay?
Yes.
And you want to check on the patient if there's any deviation on the nose as well? Any history of any accident
No.
in the past? Okay, it doesn't seem like her nose is deviated or her septum is deviated. So you would like to also document that in your chart. Okay. And then you want to check on her joints, on the temporomandibular joint, to see if there's any inflammation, any enlargement. You would like to let the patient open, please. All right, and close. Open and close. All right. Do you feel that there's some clicking or popping on your joint here if you're opening and closing?
No.
Okay, looks like it's smooth. It doesn't feel like it's popping or clicking. All right. Okay, everything's looking good. So all right, so there you go. I've already assessed her head and her neck, and I don't feel any signs or symptoms or any enlargement that I could palpate from her. Everything is normal. So you would like to document all your findings, and if you have any abnormalities and you found that from your assessment, you want to address that to the doctor. That way they could see if there's any test needed for her, any recommendation or treatment planning that needs to be addressed. All right, so everything's looking good. I will be documenting all this data, and I will be giving this to the doctor, and we will give you a call if there's any findings that we could see that doesn't seem to be normal. Okay.
Okay.
So I would like to do my hand hygiene technique. I would take off my gloves and do my hand hygiene technique, and then you want to dismiss your patient afterwards. All right, thank you so much.